Sammy Corbett has lost count of the number of times she's attempted suicide.
I don't know the exact number, but well over 20. Well over.
Her first attempt was 4 years ago when she was just 20.
Yeah, that's when I started to get help, because having an attempt kind of makes people notice you.
Sammy uses the word help loosely. Accessing support has felt like a battle every step of the way. From her experience at Canberra's emergency departments,
They don't take you seriously, they don't care, they knock you down,
to being a patient in an adult mental health unit.
It was awful. The nurses treated you like you weren't human.
And unfortunately for Sammy, who calls Royalla home, her aftercare has also been lacking.
They try to set you up when you're leaving for outpatient clinics. And because I'm not ACT, a lot of them I didn't qualify for, and I couldn't do a lot of them, so I didn't have a lot of options.
It's been heartbreaking for Sammy's mum to witness.
Sammy's just been so vulnerable, and the people we thought could help her have been dismissive and disrespectful. They've shown no grace towards Sammy and just a total unwillingness to help.
Bruno Aloisi is the head of mental health within Canberra Health Services. He concedes emergency departments are less than ideal for patients experiencing psychological distress.
But when someone needs to access urgent care, it's the environment that can provide that care quickly.
As for mental health units, Mr Aloisi says safety is the goal, not comfort or even recovery.
We could always absolutely make improvements, but they are designed with a specific purpose in mind, particularly at that acute end.
The ACT's Mental Health Community Coalition backs calls for emergency departments to be redesigned and treatment in mental health units to be vastly improved. But Chief Executive Lisa Kelly says too little attention and funding goes to helping people before they're in crisis.
Which is really sad, because it means that we have a service system that is waiting for people to get really unwell before they can get the help they need.
The Territory Government is spending more on the mental health sector than ever before. $178 million was allocated last financial year across all services, with 43% spent on acute care. This financial year, spending will jump to $184 million, and acute care will still enjoy the biggest piece of the pie. It's a federal government-funded service that has finally come to Sammy's rescue.
Hello, this is Canberra Medicare Mental Health Centre. How can I help?
The Medicare mental health walk-in centres in Civic and Tuggeranong are staffed with a raft of mental health professionals. They're free, open to anyone, and waitlist free. But clinical psychologist Vanessa Hamilton warns they're not a panacea and only offer short and medium-term care.
We know that best practice is multi-year, quite long-term intervention, and that's not funded in any way, shape or form. And so there's absolutely a gap there.
For Sammy, though, the weekly therapy is exactly what she needs.
It's been amazing. Like, I actually am finally learning coping skills and mechanisms. I have something to look forward to every week.
A glimmer of light in what has been a very dark tunnel. Rosie King, ABC News, Canberra.